This solution is used before a magnetic resonance imaging (MRI) scan. It falls under the category of gadolinium-based contrast agents, GBCAs. Eovist helps the MRI scan produce clearer images, allowing your doctor to more easily diagnose your condition. The recommended dosage and timing for Eovist should be determined by your healthcare professional. Before starting this medication, make sure to read the medication guide and, if available, the patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your healthcare professional. Eovist 0.25 mol/ml, 181.43 mg per milliliter, intravenous solution is given by injection into a vein by a healthcare provider, as directed by your doctor. The dosage is based on your medical condition and weight, so it's important to follow your doctor's instructions carefully. It's important to understand that the dosage and timing of this medication will vary from person to person, so make sure to follow your doctor's instructions carefully for the best results. If you experience nausea, an unpleasant taste, or a headache, these may be common side effects of Eovist 0.25 mol/ml, 181.43 mg per milliliter, intravenous solution. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor if you experience any serious side effects such as changes in the amount of urine, pain, swelling, or redness at the injection site, or swelling in the ankles or feet. Additionally, seek medical help immediately if you notice dark patches on the skin, hardening or tightening of the skin, joint stiffness, hip or rib pain, muscle weakness, or trouble moving. While a serious allergic reaction to this drug is rare, it's important to seek medical help if you notice any symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist for advice. This medication has the potential to cause kidney damage, especially for those who already have kidney issues, are elderly, or have high blood pressure or diabetes. Therefore, it is important for your doctor to assess your kidney function before you start taking this medication. Be sure to also review the side effects section for more information. Before using Eovist 0.25 mol/ml, 181.43 mg per milliliter, intravenous solution, inform your healthcare provider if you have allergies to gadolinium-based contrast agents or any other allergies. This product may contain inactive ingredients that can cause allergic reactions. It's important to discuss any medical history, especially kidney disease, diabetes, and high blood pressure, with your doctor or pharmacist before using this medication. Gadolinium can remain in the body for months or years after receiving this medication, but studies have not shown harmful effects if your kidneys are functioning normally. It's important to talk to your doctor for more details. Before undergoing surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, use this medication only when clearly needed and discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding, as this medication may pass into breast milk but is unlikely to harm a nursing infant. It's important to be aware of potential drug interactions when taking Eovist 0.25 mol/ml, 181.43 mg per milliliter, intravenous solution. This can affect how the medication works and may increase the risk of serious side effects. Make sure to keep a list of all the medications and herbal products you are using, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medications without the approval of your doctor. Always seek professional advice before making any changes to your medication regimen. If you suspect an overdose and the person is experiencing severe symptoms like unconsciousness or difficulty breathing, call 911. Otherwise, contact your local poison control center immediately. In the US, you can call 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. It's important to seek help in case of an overdose. It's important not to share this medication with others. Before using Eovist 0.25 mol/ml, 181.43 mg per milliliter, intravenous solution, you may need to undergo lab and/or medical tests, such as kidney function tests. It's important to keep all medical and lab appointments. Be sure to consult your doctor for more details. This medication, Eovist 0.25 mol/ml, 181.43 megagrams per milliliter, intravenous solution, is used as a contrast agent for imaging tests. It is administered through an intravenous injection once before the imaging test. The dosage and timing of administration are determined by your healthcare provider based on your specific medical needs. This medication is administered in a hospital or clinic setting and is not intended for home use. It is used to help healthcare providers obtain clear images of the liver and surrounding areas during an MRI. The dosage and timing of administration will be determined by a healthcare professional based on the specific needs of the patient. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.